He's spent over 30 years in the clinic and on the field, supporting both pro athletes and weekend warriors. Now, sports physiotherapist and Coreshorts creator Greg Bay is taking you inside the locker room with the show Injuries, Innovations, and Insights.
Greetings, everybody. My name's Greg Bay. I'm a physiotherapist, and welcome to Injuries, Innovations, and Insights. Today, we will be following up with podcast number 2 with Cliff Fowler. Cliff is a Canadian physiotherapist lifetime member. He's the first recipient of the Golden Hands Award and a chartered member in the UK of the Physiotherapy Society. Cliff has been a practicing physiotherapist for 53 years. He's been an educator, a mentor, an author, and an amazing innovator as well. So Cliff, welcome back to podcast number 2.
Thank you, Greg.
So listen, we're going to have a little fun on this one. I get to tell a few stories and we get to share. So a lot of people wonder how I ended up in Abbotsford after graduating from UBC. Well, a lot of my instructors were talking about this amazing educator named Cliff Fowler. And there was a lot of second talk about this other amazing educator named Earl Patman. And lo and behold, they're both in Abbotsford, British Columbia. Well, I got to know a gentleman named Barry Crocker, who at that time was a therapist with Canadian Soccer, that in which I was working with as well as a trainer. So I went out to Abbotsford and had an interview. And I was hired on June the 4th, 1987 by Cliff. And here we are sitting 33 years later, and we're still talking about it. I got to tell you, I'm the luckiest guy ever. I've worked over 29 years directly with Cliff out of his 53-year career. It was my start, and I can tell you some stories about mentorship. Now, one of the things is when I first started, I started on a Monday, and it was a few days later, there was a book on my desk. And the book on my desk, and there was a note that said, "Read this." And what it was the copy of Cyriax's orthopedic medicine book. And it's volume 1, Diagnosis of Soft Tissue Lesions. And the next part of the question was, on Monday, tell me the 5 signs of the buttock. Well, it was like, wow, okay, here we go. So it was an amazing gift to get from one of the fathers of orthopedic medicine, Cyriax, and it's been a very dear and very close book, and I still go back to read it because it is a really good way to help formulate your brain and your thinking. So Cliff, welcome to the show.
Thank you.
And thanks for Cyriax. Yeah, so what a gift. So tell us, Cliff, you had your therapy clinic in Abbotsford. Now, one of the most coolest things for me and invited guests was something that happened quite often on a Friday afternoon. Tell us a little bit about what would go on.
Oh, Friday afternoon when we finished work, we used to go to a local drinking hole, which at that time I believe was the Fraser Valley Inn, and we used to get round, have a beer and chew the fat and talk about things.
Yeah, putting it lightly, as a rookie, I would be sitting at the table with Cliff, Dr. Rick Sweeting, an orthopod, Dr. Vin Pratt, Earl would often be there, Earl Patman, sometimes Barry Crocker, and then the special guests would arrive. And the special guests, of course, would be oftentimes Diane Lee, at times Carol Kennedy, at times people that Cliff was mentoring from the US as well. So I was lucky enough to sit on many, many conversations. And one day I piped up and gave my 2 cents, and everybody turned at the table and looked at me and said, I think you better do some research on that and come back next week. So as much as I had the ability to sit at the table, you had to earn your right to get involved in the discussion, right, Cliff?
Maybe.
Come on. Well, because if you're going to say something, you got to back it up, right? It was, you just can't fly off at the cuff.
Oh,
no. So it was a great way to learn, because it was also the trust and the social, and a lot of questions were brought up, and you'd come back at a later date and try and present your answers. And for me as a young therapist, it was such an adjunct to learning. The one thing that I sort of find today is that type of learning doesn't occur because we have busy lives. We don't take the time to get together with colleagues. And if you do have that in your work environment, nurture it, because keeping privacy protected, it is such a great way to be able to share information. So you can just lay it on the table and discuss it. Of course, number one is keeping the privacy, though. So that was a great honor to be able to have a beer and get educated at the same time. The other thing is that sort of led to a really cool event because of us having a beer and discussing things. And I was busy working teaching an athletic injuries course with Dr. Greg Anderson at the university here in Abbotsford. And when we finished, we met up with colleagues Ted Tilbury, Greg Guizo, and of course Cliff. And that night we were bantering around the fact that groin injuries, and I don't know, do you remember that night at all, Cliff?
Vaguely.
I know. You remember the aftermath because we've been working on it for the last 22 years. So it was that time, and partly due to the fact that one of the things that, Cliff, that you always push is if you've got a problem, how do you solve it? And we talked last podcast a little bit about the fact that you're a real keen problem solver. And our problem that night was really the fact that groin wraps didn't work, and we were just teaching it in class. So we sat down, had a few beers, and we looked over the anatomy that we know and how some of these anterior and posterior slings work together. And we started doodling on the back of beer coasters. So it was that time with my posse of group, and led with Cliff, that we came up with the idea of Coreshorts. So here we are, full circle, and still going.
It's good.
Yeah, very good. So one of the things about teaching, Cliff, has always been about your enthusiasm. Tell us a little bit about your, just how you look at things. When you look at a problem and you're going to work it out, what do you do? What type of things go on through your mind?
I basically follow Cyriax to start with, as far as looking at things like passive movements, active movements, and resisted movements, if I'm doing the peripheral joints. Not so much in the lumbar spine, I don't do that, but I do in the cervical spine. And observation, still the key thing to start with. Cyriax was good at history, very good at history, probably the best history taker I've ever seen. And I've seen a lot. But I think I'd follow that kind of thing, a logical progression.
Yeah, you certainly allow yourself then to take a look at so many different aspects, so you try not to miss something along the way, right?
Yeah, well, you think of, osteogenic, neurogenic, your arteries and your nerves and things like that. So you go always in an order.
Right.
And keep in the order, and don't change the order. And that's the key. And
that's the key. And I think that your teachings and the development through the orthopedic division that you guys worked on really created a format for learning based on the processes of consistency, not only through taking a history, but also the consistency of completing your scans.
Yes.
Yeah. I even find today that because of time restraints and treating people, You don't need to get the full scan done on one day, but in the end, you've got to complete it over a session or two, because it's not about what you know, it's about what you don't know.
Yeah, well, there's usually more than one thing. So if you find something and stop, you're going to miss something. In fact, you're going to miss a lot.
Yeah, absolutely. So the one of the things that you were teaching us early on is the 3 A's of private practice. What are those?
3 A's of private practice. Okay, the first A is availability. If you're not available, you can't treat anybody. So available, you have to be. So that is my number one thing as far as importance. The second is affability. If you can't talk to people and listen to people with gentleness, it's no good. You can't be arrogant with patients. You can't be not listen to them properly because you don't like them. You have to cut all that aside and go, I'm available, I'm affable, and then the last one is ability. Once you've got your information, now you've got to treat the patient.
Right, and it's and that's still absolutely key to today for the success in private practice, isn't it?
Totally.
Yeah. So the 3 A's, easy to remember. It's availability, affability, and then ability. Very good. Now, one of the big things is that you have touched the minds of thousands, both in the physiotherapy profession, as well as a number of other health-related professions here in Canada, the US, and around the world. So what I would like to do is play a little word association game with you. So I'm going to give you a name, and I want you to just tell us a quick little story about the person that we're going to name. Are you ready? Yeah. Let's start with that author of that one book you gave me. Let's go with James Syriacs.
James Syriacs, he was the orthopedic physical doctor at St. Thomas's Hospital in London. And he was an unusual man in that his whole life was orthopedic medicine. He did, according to his wife, he had no friends because all he did was medicine. He was completely raptured in it. But he did treat lots of people, thousands and thousands of people, right, and had great teaching clinics. The affable part, I'm not so sure about.
But a trendsetter and an innovator, for sure.
Totally.
Yeah. Well, that's so cool. And now let's, what about doctors, James and John Minnell?
Okay, so John Minnell, again, was the orthopedic medicine doctor in St. Thomas's. And he was in the late 20s, 1932 era, way above his time. Did an awful lot of work, wrote 2 gracious books, one on the spine, one on the peripheral joints, and had one son, John Minnell, who went to New Zealand. That's it.
Yeah. And how about Dr. Alan Stoddard?
Alan Stoddard, he was a physical medicine specialist at the Brook Hospital in southeast London. He's got his physician's degree and then did osteopathy. Now, the osteopathy in England at that time was that if you went in without being a doctor, it was a 4-year course. If you were a doctor and did the course, it was a 2-year course. And that's what he did.
And another trendsetter and educator?
Oh, yeah, totally. He again wrote 2 books, one on the practice of osteopathy and one on the practical part of osteopathy.
Wow. It's so cool because it really was an era when things started to come together, right? Mm-hmm. The world became a smaller place. The transfer of knowledge became more integrated, and certainly the debates continued, right?
Yes. I opportunity of working in the same clinic as him on 2 or 3 occasions. In 1957, while I was a student, and again in 1964 when I did an even clinic at that hospital.
Well, so, you get to pass on a lot of the mentorship and people that touch you, and we get to go on through the generations. Let's move to some of the physiotherapists trained. What about Freddie Koltenborn?
The first time I met Freddie Koltenborn was through John Oldham. John Oldham had gone to Stan Parris's clinic in Boston in 1969, I think it was, and he brought Freddie back to give a course in Vancouver, and he did a course in Vancouver in that year, and then he came back and did a course with Olaf Eversnath in London, Ontario, in the following year, which would be 1970.
Well, we certainly have, not only read a lot about it, about him and Olaf. Now, was Olaf Freddie's sort of partner or assistant or what?
No, I think they had their own separate clinics. I think Olaf worked for Freddie for some time. Excellent clinician.
Yeah. And what I've got here from, your library is one of the Freddie Koltenborn books on specialized techniques for the extremities. And, you've got your date, of course. It was done in 74, the book, and Cliff Fowler in 75.
This book actually was interpreted by the physiotherapist working with Dave Lamb, Barbara Robinson. And she did that.
Nice.
She also went to Norway and worked there for a while.
Is that right?
Yeah.
Wow, that's fantastic. And so what about Robin Mckenzie? I mean, Robin Mckenzie's one of the most famous innovators for the physiotherapy world.
Yeah, he was certainly an innovator as far as his
lateral shift.
Lateral shift, yeah. He's basically all his stuff is on the disc.
Yeah.
So that's what he thought was happening, and that's what he treated by happening. So basically, he was doing a passive movement to correct a disc problem, which had caused a lateral shift.
Right, and certainly, we've got this book by Robin Mckenzie called The Lumbar Spine, and I'm grateful to be able to have it from your library. And it's the research on discs continues. The adaptive capability of Robin Mckenzie's initial approach continues, and I think that again, we're looking at some original innovation and putting themselves out there. And certainly we continue to use a lot of the techniques that Robin Mckenzie developed.
Correct.
Yeah. So let's move on to Jeff Maitland now.
Okay. Jeff Maitland, Australian physiotherapist, teacher. He brought in mobilization of nerve endings in the capsule of the joint, the ligaments around the joint, and had certain grades where he went grade 1 to 4 of mobilization without coming to end range.
Well, and that's, again, there's Maitland's peripheral manipulations. This is the 3rd edition, but, certainly is relevant to today in mobilizations and is an important piece of any library.
Yeah.
Yeah, absolutely. That's fantastic. Let's go to Brian Mulligan.
I've met Brian Mulligan, but I've never had a course with Brian. He's basically a peripheral joint chap, and So I don't really know a lot about Brian,
Mm-hmm.
in actual fact.
Well, I've been on the SNAGS course, and years ago, and I think it's important for any young therapist to be able to take a look at some of the origins of the Mulligan sort of approach, because it's very useful for every day, right?
It's nags and snags.
Nags and snags. That's it. Yeah. Yeah. So, well, the next person just you've touched on in our last session, but I want to come back to. And I remember sitting in your office one day, and you were talking on the phone, and I thought, oh, that's interesting conversation. And when you hung up, I said, who is that? And you said, oh, that was Greg Grieve. And then you said, oh, I'm going to England next week. I'm going to go have a pint with him and have a visit. And I says, well, Cliff, can you get him to autograph something for me? And tell us a little bit about Greg Grieve.
Well, you spoke to him.
I did. I know. You put him on the phone. I was like, holy cow. You know, people have heroes, and they've got these people they respect, rock stars, movie stars. I mean, a lot of mine are like Greg Grieve. I got to talk to him on the phone, and then he starts laughing and, telling a story. And when you came back from England, I had a beer coaster signed by Greg Grieve. And I think, wow, beer coasters in me seem to be something special, because Coreshorts was on a beer coaster. My autograph that I still have from Greg Grieve is on a beer coaster. But, I think that, in the physiotherapy world, there's rock stars, there's, and for me, he certainly was one that it was exciting to at least have a conversation with. Yeah. So, and what about Jenny it's Hickling, right? Yeah. Jenny Hickling.
Jenny Hickling helped out on the, she did a lot of work actually on the 3-month course. And she, as I said before, she's a chief therapist of Sirex's private clinic in Wimpole Street. And she was just an excellent teacher, excellent clinician, and very affable.
Very affable. Nice.
And always available.
Right. There you go. The 3 A's apply across the board. And how about Stan Paris?
Stan Paris came to the States same year as I came to Canada, which was 1966. We met up in 1967, basically because of John Oldham knowing Stan, and he got him to come to Toronto for a lecture. And we managed to turn out 200 people for that lecture, so that was good. This was the beginning of manual therapy, basically, in Canada to some extent, by physiotherapists anyway. And there was a lot of interest coming in at that time. So anybody who was doing manual therapy were giving lectures of some kind, or just a small lecture, something they'd learned on another course, that kind of stuff started to get passed on. So the awareness was there, it was building up.
Yeah.
And most of the manual therapists at that time in North America started to get in touch with each other as we evolved.
Well, certainly in the Physio Association of BC newsletter a year ago talked about you being one of the founding sort of fathers of manual therapy and acupuncture, actually, in British Columbia when you came.
I don't know about that. I did acupuncture.
Yeah.
Whether I was the first one, I don't know. But I was very interested in doing acupuncture with mobilization and manipulation, and did do it for a long time.
Yeah. Well, I remember when I started, it was really interesting in how you would use, acupuncture and relate it to then mobilizations, but also exercise as well, to try and create some better movement patterns. So let's move to some of your Rat Pack gang now, your founding fathers of Canadian manual therapy, John Oldham.
John Oldham, New Zealand physio, did a manual therapy course prior to 1966. Don't know much about the course actually, but the John and I met up in '67, and we were involved in trying to get the North American Manual Physiotherapists Association with Stan Paris, John Minnell, and it ended up with Stan Paris being the president and John Oldham being the vice president. And unfortunately, that all went down because Canada came out of that deal because the CPA had given us permission to start our own group if we passed this exam, etc. Mm-hmm. And they couldn't get that in the States. So they carried on with theirs and we carried on with ours.
Ah, right. And let's talk about one of your good friends, David Lamb.
Brilliant. Just brilliant. Dave was one of the best students who went through the Army school. He taught at the Army school. He was assistant principal at the end before he came to Canada. And he also, by the way, for IFOMT, he was an examiner for IFOMT worldwide. So, and he taught a few courses in Denmark and Holland. So, good clinician, excellent speaker as a symposium. Everything he did was good.
So again, you were looking at some amazing innovation.
Totally.
Absolutely. Yeah. And how about Alan Morgan?
Alan Morgan. Alan was, he came at his army again. He was a bit later. He came probably about, he would be about 4 or 5 years after us. So, and then he went in the army. He transferred into the Canadian Army and did a 3 or 4 year stint there before he came into the civilian kind of physiotherapy. But he passed the exam, was a good teacher. He just unfortunately died young.
Mm-hmm. Yeah, that's for sure. I know that our next name on the list, Jim Mcgregor.
Jim came to Canada in '67. Once again, he was Army, did a manual therapy course with Maitland. Did some teaching in when he was in Ontario at Hotel Dieu. Then came to BC. Didn't do any teaching particularly in BC. Not only the people in his clinic.
Well, in his clinic it was really cool. In my grad class was Mark Rosardo, who's gone on to international notoriety as a top sports therapist and one of the top for Canada, who bought Jim Mcgregor's clinic, and so his clinic has evolved into one of the major clinics in Burnaby at Metrotown. So. The stories don't go far from knowing somebody anymore, do they?
No.
Yeah. So speaking of stories, I was in your office and then you were talking again on the phone and you were talking, okay, Blair, and da-da-da. And I'm thinking, wow, this is weird because I came out to work with you and Barry and I came from Cranbrook, and one of the reasons I went into physiotherapy is because I had a series of knee injuries playing hockey, and my therapist at the hospital was an old Scottish Army dude named Blair Farish, and he was awesome. He was just terrific. And so you're talking on the phone now, Blair, and I just thought you hung up, and I said, "Who are you talking to?" And you said, Blair Farish. And I says, "Are you kidding?" He was my physio. That's one of the reasons I got into physio school. And you said, well, he's one of my best friends. And I never even knew that. Like, it was like a serendipity going on, you know? So tell us about Blair. He is an amazing, amazing person. He's authored 2 really cool books. And, but tell us about your good buddy, Blair.
Yeah, well, Blair came to Canada 2 weeks before I did, went to Sarnia as a chief therapist. And then when I left North Bay, he went up to North Bay and worked there for a while. And then when he left North Bay a few years later, which was he came and worked with Dave Lamb and I in Red Deer in our private practice, and then went to. And as I left Red Deer, he left also and went to Cranbrook.
Oh my gosh. I know the world, you don't have to go far before the world collides, right? So, and what about Swoodeem, Mr. Jim Meadows himself?
Jim Meadows. Well, Jim came to Canada and approximately went up to Powell River to start with, got a job up there, and then he took over the physiotherapy department at Abbotsford. And that's where we met. And one day, and we were good friends straight away. He'd gone through a Syriacs course in England and also went to Norway and done some work there. And then he went into private practice in Langley. Since then, of course, he's branched out and become quite a therapist and a lot of teaching in the States. Yeah. Wrote a very interesting book, which is worthwhile reading on clinical protocols. And he's kind of retired at the moment.
Yeah. Like you, I would imagine.
I'm retired.
Well, the next one in this group, we got another one is Therese Lord.
Therese Lord, she's from Quebec, and she went to Ontario, was working in Ottawa, or Oshawa, one of the two, and she did a course from someone in France, and then did all the manual therapy courses and taught in Quebec and Ontario and in BC. And she's been a stalwart and done an awful lot of work outside of teaching.
Yeah, absolutely. And what about David Isles?
Dave Isles from Winnipeg came to BC, went to the island actually, in Vancouver Island in Victoria. Started a clinic there, did all the courses, passed the exam very, very well indeed. Very clever guy. Unfortunately, once again, he's had to retire early.
Well, I'll tell you, there's such a group of innovators who always asked more questions than they knew the answers to, in order to allow so many of us to gather more information. And certainly that group of that came over to Canada and was from here really set not only the standard, but they really set the capability for education to happen, and sort of brings us into the next sort of generation, if we will, of therapists, and who none other to start the conversation about the lady who I've got 4 or 5 books from. The lady who I used to, as a rookie, sit and enjoy a beer, who this lady has failed me on my part A exam, and thankfully so, deservedly so. But also she has joined the club because I actually failed 4 times in my manual therapy exams. So for all you people out there, after doing the exams 5 times, I actually start to learn a heck of a lot more than just doing it once. So that was the silver lining. So let's have a little discussion about Diane Lee.
Oh, she's just super. Super educator, super clinician, super person, can do everything, can teach, can speak faster than most people in the world, and you can understand her at the same time.
You can. Yeah.
I don't know if I can now. But no, I can't say enough about Diane. She's a very good friend and very, very good clinician, teacher, and just a person.
Well, she certainly credits a lot of her keen interest in orthopedics and manual therapy because of some of the time that she spent with you, that's for sure.
Yeah.
Not much to say about that, eh?
No.
Oh, we've got to talk about Early the Pearly. So tell us a little bit about your good friend who authored an amazing book as well, an amazing teacher, an amazing educator who's written a bunch of articles. Certainly one of the funniest guys you'll ever meet. What about Earl Patman?
Well, Earl's the same as Diane. They're both exactly the same in that he doesn't talk quite as fast as Diane, but an amazing innovator. And he's actually done twice as many tests that I've done. So if I've made out 10 tests, which wasn't being used before, he's done 20. But super guy.
Yeah, and you know, I think what part of the common thread is it's the friendship as well. It's respect, of course, but it's respect because of the commonality of trust and friendship throughout the years.
Yep.
Yeah. Well, and you know, we head on to say a few words about the amazing Carol Kennedy.
Carol, she went on a 3-month course with Diane Lee as the head teacher. There was 2 of them actually went together because they were 2 really good friends, was Carol Kennedy and Debbie Trelaw. And both of them were fantastic people on the course. I saw them both as coming to the clinic and did some work with me for a week. And I knew these were going to go somewhere, so they got a bit of a help. and the help was trying to get them to do some teaching or give a lecture to start with and get them to assist on a course. This is once I'd passed the exams, of course.
Yeah.
And that's what you usually try to do. We wanted teachers, so that was the main thing, because those old guys were past it. So and they came along and they did a very good job, and they're better than us. So we said thank you very much.
Well, and you know, that group was my primary teachers as well, and we had a lot of fun. And you know, and one of the things that impressed me the most is that year after year the teaching evolved, or the information evolved. So they were never stuck into saying this is the way we used to do it and we still do. It's like, hey, this is the way we used to do it, but let me explain why we're changing that. And then it's about getting you to think that way. So again, not just showing you, but really getting you to intuitively understand about connecting your hands to your brain so that you can have a better result and a better outcome. Yeah, so fantastic. You know, and then one of the other, and they're all Golden Hands Awards, and just a few years ago, Jan Lowcock.
Yeah, Jan was another person. She was working with Diane Lee in her clinic for many, many years. Another person who was excellent as a teacher, excellent as a clinician, super girl.
Yeah, and again, a fantastic teacher, but not just teaching, but there's another sort of level of education that goes along with that. And I've got, there was a number of books that were produced in the sort of late 80s and 90s. And it was collaboration between Diane and Mary Walsh. And again, here we are talking about some amazing educators, and Mary Walsh was one of them.
Yeah, she was exactly the same. She did a lot of teaching in Ireland with a partner who is now, was it
May Nolan.
May Nolan.
I know.
Yeah, she was, and they wrote a nice book on the hip joint.
Yes, they certainly did. They did a great book as well. It's clinical assessment and treatment techniques for the lower extremity with Mary Walsh and May Nolan, and May continues to teach at UBC. I will say that, I'm really curious to May, if she's listening, about a few of the pictures in this book with some legs that are in here. I won't get into the specifics, but I do know that if you're out having a few beverages late at night and the camera comes out, that you might end up in somebody's book without actually knowing it. So always be careful around some of these authors. You never know when they pull pictures and stick them in books. So that's all I'll say about that, Cliff. Yeah. So, and you've had a good friend, and has been so important to the sports field. And of course, there's been a number of them, but Clyde Smith has he's been amazing as well.
Yeah, Clyde was he was involved in sports therapy, and I think he did a sports therapy exam. Was that in the States or was that here?
I'm not sure, but he's certainly been one of our forefathers and leaders for sure.
Oh yeah, he went through the courses, did Clyde. Yeah, I agree with you. He's been tremendous help.
Yeah,
he ran the physiotherapy department at UBC.
Yeah,
for many years, and was a great help to anybody who asked.
Yeah, and also Dr. Reed.
Yeah, Dave Reed.
Dave Reed, and also
Dave Reed. He was an orthopod in Edmonton. He was a physiotherapist first and a physician, and then an orthopod. He wrote an excellent book too on sports medicine.
Absolutely. And then what about the other guy from Edmonton who's amazing, Dr. Dave Mcgee?
Dr. Dave Mcgee. I didn't know Dave that well. He came on a couple of manual therapy courses, but he was the principal of the physiotherapy school.
Absolutely, and a great author. And he was my examiner when I went through the sports levels, and I finished taping his ACL on his knee, and he said to me, "What did you forget?" And of course, you're doing the exam. I think, I don't know what I forgot. And he says, "You didn't ask me if I was allergic to spray." And I thought, okay, are you allergic to spray? And he says, "Yes, I am." And I thought, okay, I'll be doing this exam again. So first question you need to ask is, are you allergic to the spray? And I missed that one. I'm sure glad I did a nice ACL tape job, that in which I don't do hardly. I don't tape ACLs. But anyway, I got through the exam, and everywhere I got to travel, whether it's different courses or different aspects of therapy in Canada and the States, you don't have to go far between the fact that people are asking if you know Cliff Fowler. And I get to say, know him. You've been the greatest influence in my career. And I am very selfish, but I know you've been such a huge influence on thousands of people's careers. You've touched their hearts and their minds. And in particular, you've opened up their brains to be able to be thinkers as well. And that is something that is so cool. And, I had a question down here to say, what would you like Cliff Fowler's legacy to be? And then I thought, well, quite often that's up to other people to decide what Cliff's legacy is or was. But, 53 years as a physiotherapist, what is some of the aspects that you look back in your career that you're really proud of?
I went on the course, the manual therapy course. And if people go on manual therapy courses like I did and got the same buzz, that would be fantastic.
And that was because they were such great educators that got you excited as well, or, that turned you on to it?
Just a system of examination.
Right. Wow. So you never know sometimes where things are going to turn the switch, right?
No.
What advice do you have for new grads today? Here you are, 53-year career and retired. Do you have any advice?
Well, it's very different now. It's gone from a diploma to a degree to a master's, and the States now have gone to doctorate. So I suppose we'll follow them eventually, and they'll all be doctorates. I don't really know what's going to go on from there, actually, because once you're going that route, you're going more for research. So it's going to be interesting.
And you've kept yourself busy now. You do a lot of stuff, reading and a lot of research on different things, including your stock portfolio. And, what's one of the greatest inventions that you're super happy about now?
Computer. Without question. You got the largest library just right at your fingertips.
Yes.
It's absolutely fantastic.
I can call you at any time and you'll say, I've been up since 5 o'clock reading, and you go down so many rabbit holes, don't you?
Oh, I never know where I'm going to finish up. I mean, when you're retired, you've got the time.
I never know what conversation to expect from you either, because it's like, holy smokes, where did that come from? So one of the things, I thought we could just sort of touch on is the fact that in March of this year, which is 2020, the world was under siege with a pandemic, and it was the coronavirus. And we won't get into detail, but here you are, Cliff, at 83 now, and you've had some neurological conditions, and you ended up with the coronavirus in March. Mm-hmm. Tell us a bit how you got it. What was that experience like?
Not good. It wasn't. It's not good. If you're like a lot of people get it and they get very weak symptoms. Mm-hmm. I just didn't do that. I went there, got some bad symptoms, but we got through it, and now we're all right.
Well, you didn't just get through it. I remember, receiving a text, and it was just a text, and I'm so grateful because, of course, you couldn't have visitors, and you had to go into the hospital to get a treatment. And that's where they believe that you contracted the coronavirus. And 4 or 5 days later, you were taken via ambulance in. And like you said, it wasn't good, very grim. And by golly, here you are sitting and looking amazing. How are you feeling?
Pretty good, actually. Mm-hmm. No complaints.
Yeah, you never complain anyway.
No complaints.
Well, I think that there's a few things. One is that we still need, obviously, to do our part and be very considerate. With that said, I also think we need to celebrate some of the successes and some of the people that have gone through the coronavirus and lived, and take a look at the fact that there's a lot of human resilience attached to that. And for you to be sitting here and doing this today, as well as your first podcast, is just a great testimony to what your iron will is as well. And that certainly has been represented for the years. So listen, Cliff, on behalf of the thousands of patients that you've touched the hearts and bodies of, and on behalf of the thousands of therapists around the world that you have made such a positive influence on. I just want to represent them and say thank you.
Thanks, Ray.
And thanks for working with me on the Coreshorts for all those years. So it's just, I'm so grateful. And it's must be time to have a bevy, right?
I'm sure it is.
All right. So everybody, I hope you enjoyed the second podcast with one of the most amazing innovators, original thinkers here, Clifford Fowler, on injuries, innovations, and insights. We are so excited to have you back again as we bring some very relevant and important topics to you. But thanks for joining us today. And most importantly, thanks to Cliff, his wife, Pat, his kids, Rick and Dave as well, because it takes a whole family. Right, Cliff?
It does.
Absolutely. So it's my turn to buy the beer. Thanks, everyone, and we hope you enjoyed today.